If you've had back pain and sciatica for over a year and treatments are only addressing your symptoms, not the root cause, this video is for you. John with Recover Pain, and I'm going to show you the 4 phases chronic pain goes through and 4 simple tests you can do at home to see which phase you're stuck in. I'm not a doctor and this is not medical advice, but we worked with over 3,500 clients with chronic pain, and this is me sharing advice that's worked for them. This will most likely help if you've had back pain or sciatica for years and you've already tried physical therapy, chiropractic, massages without success. Almost everything you've been told about pain is incomplete. For example, we had a client, he'd been dealing with back pain and sciatica for 10 years. L4, L5 herniated disc, tried physical therapy, chiropractic, injections without relief. Eventually, he had surgery. The disc issue was fixed on the MRI scan, but a few months later, the pain came back worse than before. When we first spoke, his biggest question was, if the disc is healed, why am I still in pain? As we mapped his story against the 4 phases I'm about to show you, it became clear that his pain wasn't a fresh injury. He had chronic sciatica. Over the next few months, as he worked through these phases step by step, he went from avoiding golf completely to playing 18 holes pain-free and sitting a full workday without a flare-up. So what does that mean? What was causing his pain? With the disc healed, how could the pain have come back? Was this pain in his head or was there more to it? If you've been in pain for long enough, you've probably been assigned a problem that's blamed as the root of your pain. A herniated disc, a tight muscle, a leg length imbalance, poor spine curvature, a bulging disc, stenosis, arthritis, and so on and so forth. And if you're watching this video, you probably tried every treatment available to fix it, but the pain's still there. But what if there's something more to it? Most people confuse acute and chronic pain. Acute pain is when you tweak your back, herniated disc, and your pain flares up for a couple of days or weeks. This pain is more likely to have a single cause like a herniation, stenosis, or tightness. But if your pain stays longer than 3 months, your pain is now chronic and there's more to it than just an injury. Chronic back pain and sciatica have 4 main phases of development. Phase 1 is the trigger. This is where something kickstarts your pain. It could be a number of factors. Some of these may apply to you. You herniate a disc when lifting something heavy. You sleep funny. You sneeze and your back seizes up. You have a really stressful week at work. Your back locks up during a round of golf. Regardless of the trigger, something crossed your nerve's pain threshold, causing it to alert your danger and turn on a pain response. Here are the main ways to tell if you're in phase 1. Has your pain just started over the last 12 weeks? Is it very predictable, where the same movement always causes the same amount of pain? Does it stay in one spot and never change positions? If so, you're likely in the trigger phase, where the main goal is reducing irritation and getting back to movement. Once you've been in pain for longer than 12 weeks, you enter phase 2, sensitization. Here your nerve roots have been compressed for long enough that your nerve adapts to this new state of pain and starts a process called sensitization. This is especially common in people who have a high pain tolerance. Your nerve starts conducting pain better, so the same amount of compression can cause more pain simply because your nerve is more sensitive. The longer you're in pain, the more sensitive the nerve gets, and even if your original injury isn't worsening, the pain certainly is. You've probably noticed this with yourself, where over time it takes a lot less to trigger your pain. Phase 2 usually lasts between 3 to 6 months after pain started. Then comes phase 3, Re-Paternization. So at this point, you've been in pain for 6 months. Your nerve was first irritated, and now it's hypersensitive. In phase 3, your central nervous system starts patternizing pain. For example, if every time you bend forward, your nerve gets more irritated and hypersensitive, after 6 months, your nervous system attaches a pain response to bending forward. The next time you try bending forward, you instinctively brace your core, bend forward more carefully, and your nervous system recognizes this as additional evidence that that movement is dangerous and makes it more sensitive. An example in daily life is food poisoning. Someone gets food poisoning after eating sushi and they throw up all night. Now 5 years later, they smell sushi and they feel nauseous. They never eat it again. The nervous system has learned that sushi equals danger. The same happens when bending forward triggers your pain. Now every time you bend forward, you brace your core, act cautiously, and your nervous system patternizes bending forward to pain. Another example is sitting. If your pain constantly flares up when sitting, your nervous system learns that a 90-90 position is sensitive, and soon after, sitting becomes even more painful. This usually happens within 6 to 12 months of your pain starting. And after 12 months, we enter phase 4, the self-feeding pain loop. If you've been in pain for 12 months or longer, your pain started with a trigger, the irritated nerve got hypersensitive, the nerve started connecting certain movement patterns to an increase in pain, and now after 12 months, the pain becomes a self-feeding loop. Here's an example in daily life. A baseball player makes an error at a big game. He strikes out. One bad moment, but now he's terrified of striking out again. He steps up tense, tension makes him swing weird, he strikes out again. Now his nervous system has proof. Yeah, you're gonna strike out. He's even more tense the next time. He strikes out again. The original error was one moment, but now the loop is running the show. He's a good hitter, his mechanics are fine, but the nervous system is making him strike out over and over again. A similar pattern gets built in your nervous system when you're in pain. You have pain, so you get scared. You avoid bending, stop moving, stop sitting the way you used to. You protect, you brace, and you guard. The longer you're in pain, the more sensitive the nerve gets. Then the nerve starts patternizing pain. Every time you bend forward, it takes a note, and makes bending forward more sensitive. Every time you avoid a movement because you're scared, your nervous system says, good, we dodged a bullet. That movement really is dangerous. So the sensitivity gets greater. And now at this point, even if you address the root of your pain, the herniated disc, stenosis, leg length imbalance, the next time you bend forward, your nervous system still recognizes the pattern and keeps building the pain response. So even if we fix the original problem, by now the nervous system has enough proof that it keeps building the pain pattern. That's why so many people in chronic pain end up going through surgery, injections, stem cells, without their pain ever changing. So what can you do? Think of your pain like an electric guitar. There are two ways to make a guitar louder. You can strum the strings harder, aka worsen your injury, or you can turn up the volume, aka make your nerve more sensitive. The strings are your body, your back, your spine degenerating, and the amplifier is your nervous system. So to reduce volume and get pain-free, we can stop strumming or turn on the volume knob on the guitar. The treatments that only focus on one of these end up keeping you stuck in pain. For example, imagine if you just stop strumming the guitar, but the volume knob is still turned up to the maximum. Any small bump or scratch like sneezing or bending forward is enough to trigger the guitar and cause pain. Or if we just turn down the volume but leave your injuries, aka keep strumming, there will always be a certain amount of noise present. So to successfully recover from chronic pain, we need to address both the strumming and the volume, both the root of your pain and the nerve sensitivity. Now, if this approach is making sense and you just want to skip ahead and want our help to identify the exact root of your sciatica, complete our sciatica assessment below. And if we see your case is treatable, you'll get a free personalized assessment with our team to build a program and get pain-free for good. Okay, so how do you know which out of the 4 phases you're in? Let's figure it out with 4 simple tests. If 2 or more tests positive, that's the phase you're in. Test 1, the easiest, is the timeline. How long have you been in pain? If it's been less than 12 weeks, you're likely in phase 1, the trigger. If it's been 3 to 6 months, you're in phase 2, sensitization. If it's been 6 to 12 months, you're in phase 3, paternization. And if it's been 12 months or longer, you're in phase 4, the loop. Test number 2. Is your pain local or is it changing spots? If your pain is local in one spot, it's more likely you're in an early phase and your pain is more structural. If your pain constantly changes spots from your lower back to your glutes to your hamstrings back to your lower back, you're more likely in later phases where your nerve is hypersensitive, causing it to travel through the nerve. If this was just a structural injury, then it couldn't just move spots randomly. Test number 3 is pain consistency. If your pain is consistent, where bending forward causes the exact amount of pain, and when you're sitting, your pain always starts after the exact same amount of time, you're more likely in the early phases where your pain is structural with a disc or muscle irritating your nerve. If your pain is inconsistent, where bending forward sometimes triggers pain, other times it doesn't, you're more likely in the later phases where your nerve is hypersensitive because your nerve's threshold can fluctuate day to day. And test number 4, if your pain is only affected by internal factors like bending forward, sitting, sneezing, it's more likely you're in the early phases and you're dealing with an acute injury. But if your pain is very easily affected by external factors like cold weather, going on vacation, you're more likely in the later phases where your nerve is hypersensitive and reactive to your environment. Based on these tests, you now know what phase you're in. To get pain-free, the earlier we start, the better, because the less time your pain is had to develop. Step 1 is addressing the root cause. This is the first step towards breaking the loop. We have to reduce irritation around the nerve roots. Depending on who's watching, you'll have different root causes: herniated disc, inflammation, stress, tightness, sensitivity, trauma, degeneration, stenosis. The first step should not be focusing on pain relief, but instead on reducing irritation around the nerve roots to fix the root of your pain. The easiest way to identify your trigger is to do a pain chronogram. You start by drawing a line from your birth until today. Then you sit down for 20 minutes and focus on mapping out major life events. Here's an example from one of our clients. October 2012, a car accident. In November 2013, he met his girlfriend. In January 2015, he broke up with his girlfriend. The rest of 2024 and all of 2025, he tried every treatment available for his pain. In January 2026, he started recover pain, and so on and so forth. After you map out your life events, you'll go through it again and add your pain story. October 2012, with a car accident came 3 months of lower back pain. February 2015, with a heavy work and sports load, he had a massive sciatica flare-up. The rest of 2024 and all of 2025, he tried countless treatments for his pain, including an MRI, which showed an L5S1 herniated disc. Anytime there was a severe stressful event or a change in his activity level, the pain would flare up. They likely had that disc herniation from before. Anytime these changes occurred, the herniated disc was already there and the nerve became sensitive enough to start reacting to it and trigger a flare-up. The first step in your recovery needs to be identifying the trigger and addressing it. In this case, even though there was a herniated disc, the true root of the pain was a weakness from a change in activity and an increase in stress from different life events. We need to structure a strengthening program to start eliminating weak links and, to the best of our ability, cut out toxic factors to reduce stress in your life. You need to identify your specific pain trigger and do the same. Step 2 is pain reprocessing. This is where we start desensitizing a sensitive nervous system. Just like the nerve gets hypersensitive the longer it's compressed, our job, once the nerve compression is reduced, is to desensitize the nerve to restore function. Pain reprocessing is consistently moving into positions that trigger pain to retrain the nervous system that those movements are safe. Here's how it works. Identify what movement you avoid the most. Could be bending forward, sitting, lifting, walking, whatever. Now you're gonna do that movement on purpose in a way where it triggers some discomfort. Not severe pain, but mild 3 out of 10 discomfort. Let's say bending forward triggers your sciatica. You slowly start bending forward, but right as you feel the tension building up, you hold for a few seconds and straighten back up. You're doing this with the knowledge that it's safe and slowly teaching your nervous system that bending forward isn't dangerous. Perform 2 sets of 8 reps 3 to 5 times a day. Over time, your nervous system says, okay, they keep bending forward and nothing bad happens. This is not a threat. And then the sensitivity to that movement goes down. This is different than breaking your leg and just walking it off. We're only desensitizing the nerve once phase 1 in this recovery process is completed. Think of it like a vaccine. A vaccine exposes your body to a small dose of the disease so your immune system can adapt to it and overcome it. Pain reprocessing is the same thing. You're slowly exposing your nerve to movements that are painful so you can get used to them and overcome them. Step 3 of recovery is breaking pain patternization, otherwise called somatic tracking. Here, we're breaking negative pain patterns and removing fear around movement. It may seem silly, but just bear with me for a minute. For example, if you're scared of bending forward with a rounded back, that fear feeds the pain and amplifies it. Here's what to do. When you feel pain or fear arising, stop and breathe. Sit with it. Turn your attention towards the sensation with curiosity, not judgment. Where is it? What does it feel like? Is it throbbing, burning, a sharp pain? Does it move? While you observe, send your nervous system a calm message. This is uncomfortable, but it's not dangerous. I'm safe. My body's capable. I've done this before, and nothing bad happened. This helps the central nervous system calm down. You're addressing the fear response, not the actual pain sensation itself. The second part is belief reframing. Take a piece of paper and write down scary beliefs that you know aren't true. My back is fragile. It will never heal. Exercise will make it worse. Now write down the truth. My back is resilient. Bending is how I get stronger. Millions of people with my exact diagnosis have gotten better. My nervous system is overprotective, but it can learn. Every time the fear comes up, you come back to it with the truth. This is the neurological component of recovery. Without it, you're just gritting your teeth through the pain. With this, you're retraining your nervous system. Step number 4 is optimizing your recovery. This is the foundation that makes the first 3 steps work. Pain doesn't live in isolation. It lives in your whole nervous system. Your sleep, daily steps, nutrition, stress, movement patterns. It's essentially the volume knob on our electric guitar. It can amplify pain. Here are 5 main factors that can turn the nerve hypersensitive. Sleep. This is non-negotiable. Your nervous system recovers during sleep. If you're sleeping poorly, your volume knob stays cranked. Prioritize sleep like your life depends on it because it does. 7 to 8 hours, dark room, no screens before bed, whatever you need to do. Nutrition. For an injury to heal, nutrition is how you deliver the necessary rebuilding material into your body. The main 2 things to keep in mind are inflammation and protein. Eating a lot of sugar and carbs will spike your inflammatory response and make your nerve more sensitive. And a lack of protein will reduce your body's rebuilding and healing capacity. So make sure these 2 are taken care of first. Movement. You need to move beyond the rehab exercises. Movement helps increase blood flow, which increases the amount of oxygen being delivered to the recovering tissue. So by walking, doing cardio, you're literally speeding up your recovery. Stress. Your nervous system does not separate work stress from pain stress. It's all one amplifier. So if you're stressed at work, your back gets tighter and your pain flares up. So a part of pain rehab is learning how to manage your stress. Breathe, take breaks, say no to things. And last, purpose. It seems silly to mention with chronic pain, but your body's really smart. You've probably seen this with yourself. If you get distracted at work or with a project, you seem to forget about pain for a moment. If you have a lot of important things going on, a project, a hobby, a vacation, your nervous system reduces its pain sensitivity to leave some computing power for these additional tasks. But if you're just sitting at home alone, your nerve can become a lot more sensitive, as opposed to if you, despite the pain, find movements you can tolerate and stay active and keep living your life despite the pain. These 5 recovery factors are the foundation. If they're not in place, step 1 to 3 are working against headwind. But with this, they work like a system. Now you might be thinking, but I've already done all this. I've tried physical therapy, I've fixed my sleep, I've thought positive thoughts, I've done so much chiropractic, injections. What do I do? Well, the good news is you only need to get it right once. Your body functions like a graph. Imagine the fluctuating line are your physical injuries and the horizontal line are your nerves. When you injure yourself, your pain spikes above the nerve's threshold and you feel pain. Now there are 2 ways to cause your pain to worsen. You can worsen the injury or you can lower the nerve's pain tolerance. So let's say so far you've worked on reducing your injury, strengthening your core, massage, acupuncture. You've lowered your pain spike, but you're still in pain. Why? Because your nerve's pain tolerance is still lowered. Or let's say you worked on optimizing your recovery, sleep, stress, your diet, all the things that improve your nerve's tolerance, but you're still in pain because your nerve is irritated. It's because none of these are one and done. All these 4 steps have to be done in harmony and in the right intervals so your body adapts them as its new default and saves your progress instead of falling back into pain. Here's what to do next. If you've had chronic back pain and sciatica for years, you've already tried physical therapy, chiropractic, massages, injections, perhaps even surgery, and you're starting to think maybe these factors are all all involved in my pain. My team can help you out. Click the link in the description, fill out the form, and book an assessment with us. We'll look at your specific case, your history, and your symptoms, and see whether this approach is right for you. You're not broken. Your body's not fragile. Your pain alarm is just turned up way too loud. And alarms can be turned back down. Happy recovery. I'll see you in the next one.